Hi, my name is Rhodes Hambrick, and I'm a second year and soon to be third year resident in the Boston Combined Residency Program in Pediatrics, or BCRP, which is a joint program between Boston Children's Hospital, an affiliate of Harvard Medical School, and Boston Medical Center, the main teaching hospital for the Boston University Medical Center. I am planning on specializing in pediatric nephrology, that is, to become a specialist in taking care of kids with issues with kidney function, like nephrotic syndrome, hypertension, or chronic kidney disease, including those who go on to require a kidney transplant. Applying to pediatrics was great fun. In general, pediatricians are warm, friendly, and inviting, and it was an enjoyable experience getting to travel to different programs across the country to see the opportunities available for pediatric training in various contexts across the nation. Most interviewers seemed genuinely interested in getting to know me as a person, and were as, if not more, invested in showing me what the program had to offer me, rather than seeing what I could do for their program. It was an incredibly unique opportunity to see how different programs were set up, some at large tertiary or quaternary children's hospital like Boston Children's, and others at pediatric units within larger general hospitals like that present at Boston Medical Center. There are so many wonderful options out there that making my rank list was an incredibly difficult experience. In the end, I chose to come to the place where I felt I had connected the most with the personalities and passions of the current residents, and I stand by that decision wholeheartedly. Residency is an incredibly trying process, and going through this intense training program with people with whom I can just as easily laugh, as cry, as dance, as work my butt off, has been absolutely essential to making the effort and the stress worthwhile. For those thinking about applying into pediatrics, it's helpful to look at data from the AAMC about what makes a competitive applicant. Based on those data, a strong pediatrics application will include at least a 235 on Step 1, a 240 on Step 2 CK, overall strong clerkship performance, and strong grades in pediatrics in particular, and then at least one letter of recommendation from a pediatrician. Based on match results, pediatrics is somewhat more friendly to international medical graduates than other fields are. However, matching as an international medical graduate is still far from certain. Be sure to do your research to identify programs with active IMG residents and establish proper connections to get a sense of how feasible it would be to match there. If you failed an exam, like Step 1 or Step 2, you can still apply in pediatrics, but you should apply very broadly and consider applying for a backup specialty. Expect interviews to come in October to December of the application cycle. Reach out to programs you have high interest in if you haven't heard from them by mid-November. Once you have about 10 interview invitations, you can consider being a bit more selective about which ones you actually take, but not before that. One of the most unique and satisfying parts about being a pediatrics resident is the opportunity to care for patients from birth through young adulthood. There are different challenges and joys that arise from working with each patient population, from infants to toddlers to school-age kids to adolescents. Neonatal medicine feels like a different world from adolescent medicine. Yet, as pediatric trainees, we gain mastery of both fields alongside every group in between. In the inpatient setting, we're exposed to acute pathology and learn to distinguish differences as a function of age. The 6-month-old with bronchiolitis versus a 6-year-old with asthma. While in the world of primary care clinic, we're exposed to countless examples of the broad range of variance in, quote, normal development, and how to pick up on when something isn't right. That is, one of the chief challenges of pediatrics is that while statistically most children are healthy, some children are gravely ill and may deteriorate from unwell but compensating to unwell and in need of critical care within a matter of moments. By providing us with ample opportunities to participate in the care of both those kids who are sick and those kids who are not sick, pediatrics training allows us to develop expertise to distinguish the infant with impending bowel obstruction from the baby with physiologic reflux and a caring, though overly worried parent, or to pick up on the child who's breathing fast as a compensation from acidosis, from new onset diabetes and requires immediate attention, from the dozens of children with mild respiratory illnesses who can be managed at home. I will say that people often ask me how I could stand going into pediatrics because seeing kids get sick must be so sad. While it is certainly heartbreaking to see children fall ill, particularly those rare few who unfortunately pass away from their illnesses, one of the most rewarding parts of being in pediatrics is seeing just how resilient kids are. That is, the dozens upon dozens of children I've seen who've shown up looking quite ill from a variety of ailments, respiratory distress from pneumonia, dehydration from severe gastroenteritis, profound acidosis from an inborn error of metabolism, who then bounce back from their ailments and are as good as new within days. Broadly speaking, children have amazing reserve, and it is immensely satisfying to know that by intervening early in life, even through measures as simple as intravenous rehydration or by giving immunizations, we're helping to secure health and wellness in these kids for years to come. In the end, those choosing pediatrics should recognize that this career is a unique and beautiful opportunity to become an advocate for the health of children and their families, both in the outpatient setting, in the clinics, and in the world of acute care in the emergency department, the inpatient floor, and in the ICUs. Being there for families in times of crisis requires not just mastery of the relevant medical knowledge, but also excellence in communication to provide nervous families with reassurance that their children will be well taken care of, particularly in the face of new or frightening diagnoses. For those who can muster the requisite empathy and compassion, a career in pediatrics provides unfailing rewards in helping children grow and thrive as they make their gradual transition into adulthood.